Okay, so I'm gonna try to do my first video log um, for my upper jaw surgery that I will be having in about 3 weeks. This is my first video blog ever, so it's very strange to be videotaping myself. Anyway, I want to do a video blog because I've seen some video blogs about jaw surgery, and a lot of the stuff that I'm going through, nobody really talks about on the videos. So I'm going to try to make this short, even though it's been a long journey. As you can see, that I'm not 18 years old, I am 40, and I have a jaw deformity in my upper jaw that I've had, they think, my whole life since I was a child. And so my lower jaw, my mandible, has accommodated for during my life, accommodated for my upper jaw deformity. I did not have any dental care growing up. So everything had shifted by the time I went to the dentist for the first time to get my teeth cleaned, which was at 22 years old. So I just thought that how I looked and how my jaw performed was normal. And no dentist never said anything to me because they just cleaned my teeth. They really checked my bite. I did suffer a lot. I had lockjaw for the first time around my teens in like 18 or 19. I had lockjaw again in my 20s sometime. I can't remember. I suffered from jaw pain and from daily headaches, but I just kind of took medicine, Advil, and dealt with it my whole life. I was able to exercise. I was able to chew. When my jaw locked, both times or 3 times, I think it locked in my life, I just allowed it to heal on my own, never went to the doctor. I didn't think anything of it, and eventually it worked again, which was really bad because my jaw was in the wrong place. But I just lived with it, and I was fine. I ate and I ran, but I just had headaches every day, and I had a lot of jaw pain, like I said. Um, I wanted to get to the bottom of why I was in so much pain because it is difficult to live on a daily basis with chronic pain. And so I was about 30. I was about 32 when I decided to go actually talk about what I was experiencing. Took 2 years to get diagnosed with the fact that I had a bite problem. And then it took another um, 3 TMJ specialists. One, two. I was in 2 splints, and then I was in 1 splint for only 3 or 4 months. Then I saw an oral surgeon. I was about 34. Saw an oral surgeon in Miami, and then who recommended orthodontics to see where my occlusion really was after wearing a splint for about 3 months, 3 4 months in a lower orthotic. I was still very confused as to what was really going on. Now I know exactly what was going on, but back then I didn't know what was happening. Um, I did um, I did go through orthodontic treatment, but I moved. So I went through orthodontic treatment in a different area, and I went and saw the orthodontist, and she said that she could fix my bite, no problem. Well, she did not identify my skeletal deformity. I went through 2.5 years of braces. During that time, I was pregnant, so I didn't, well, part of that time I was pregnant. I didn't feel a lot of the pain that I would have normally felt because I was pregnant. Then once I had my child and I had the braces, it was toward the end of braces treatment. I was wearing the rubber bands and stuff like that. I realized that things were still not right. And I told my orthodontist that things just don't seem right. My teeth looked great and my bite was coming together, but it just didn't feel right. I was starting to have pain again. My jaw joints were starting to hurt again. So she recommended at the end of braces treatment to go see another TMJ specialist, which I did because it hurt so bad. So I went to another TMJ specialist, and he was really pissed off because the orthodontist basically shifted my lower jaw, my mandible, again to accommodate my upper jaw. And now I had a little bit straighter teeth, and I was in the same problem, had the same problem that I was in pain. So it took working with this team specialist to deprogram all of my muscles. It didn't take 3 or 4 months to deprogram my muscles. My muscles were so confused because of the amount of I had used throughout my entire life with this deformity, my muscles were a mess in my neck and everywhere. So, and I've done a lot of other stuff along with this, but I have to make this video short. So I was in splint therapy for 3 years. It took 3 years to get me to my centric relation. Now, centric relation is basically when the TMJ specialist or the dentist manipulates your lower jaw and keeps it in centric relation together, basically these jaw joints working together to close. Anytime, even before when I was in TMJ treatment before, and when I went to the oral surgeon before, they would manipulate my lower jaw into centric relation, and I would hit only one tooth, back left tooth. Then they would let go, and my muscles would all take over control, and I would hit either all of my teeth or I would hit my two front teeth. It was literally, my lower jaw was so confused and all over the place. So it took 3 years, hence I'm 40 now, to get me to hit naturally without any interferences with my muscles not interfering with my jaw and where it wants to go, to get me to hit centric relation on my own, which is one tooth. And that's where I'm at this year in May. I was hitting centric relation naturally. I went and saw an the TMJ specialist told me, you need surgery. There's no other way to fix your problem. And referred me to an oral surgeon. I did see a couple oral surgeons to pick one that I felt comfortable with. So in May of this year, I was diagnosed finally with the jaw deformity, and this is my natural real bite, as far as no muscles getting in the way. And this is how I bite. Show you really quick. I am pretty much a completely open bite. I only hit one tooth in the back left, and that's it. So I put into braces again for pre-surgery in like June, because my teeth were really straight. My teeth were very straight. I was pretty much almost ready for surgery. But my upper jaw's in the way. So I was put into braces in June, and we are now in November. So I think I went to see an orthodontist in June. I think I've been in braces for like 4 months. It takes about a month to get ready for surgery as well. So I've been in my surgical wires for probably a good month already, ready to go. And then I also wear a splint with the braces because of the openness of my bite, to keep my jaw joints calm, and to keep my muscles calm, because right now as I'm talking to you, my brain is trying to put my lower jaw into fit with my upper jaw, so it will put your muscles into spasm. And no one really talks about that in these other jaw surgery videos. The damage that has been done because I did not get this fixed as a child or around 18 or 19 years old is that I do have arthritis in both my jaw joints, and I will have to live with that. So hopefully with the surgery, my jaw joints will be able to function, and they will actually auto-rotate into their natural seating position. So I go for surgical molds in 2 days, and then I have to go to register in the hospital, and I got to go back, and about another 3 weeks of appointments before I have my surgery, which will be December 5th. So I will show you the splint in my next video and kind of talk about the jaw joint a little bit more and what they're going to do with my surgery. But I really wanted to talk about the importance of splint therapy and the importance of deprogramming your muscles. And that's something that is very difficult to find someone that really knows how to do. And it's really exhausting on you because you have to be patient with your jaw moving all over the place and your bite changing so much. So yeah, I don't know if I'm going to post this or not. I'll have to take a look at it first, but hopefully I can help somebody out by by posting about the importance of being with a good TMJ specialist, why you're going through this journey, I guess, and making sure that your joints are where they're supposed to be before surgery. So I will talk to you again. Okay, bye.